My name is Chido, again from the Academy, but back to you talking a little bit about the community development portfolios available for the different groups of healthcare practitioners out there. Now, I'm going to speak specifically around the nursing development portfolios. In case you're wondering if you're allied health professionals today, it might not necessarily be tailored for you. However, at some point later on, we will get the allied health professional leads to come down and talk about the portfolios that might be relevant specifically to the AHPs. But for starters, we're looking at the nursing portfolios. We've got the HCA development portfolio, focusing at band 2s and 3s within CLC8. And then we've got the band 5 community development portfolio for band 5 nurses, newly qualified nurses. And then we've got the deputy team leader development portfolio focused for the new band 6s coming into post. In the middle here, we would have what we call the nursing associate portfolio. However, that is a soft copy that is currently, I think your managers or your PDNs will be able to signpost you as to how you can get a copy of that document. Quick disclaimer is that although some of these are mostly in paper at the moment, they will be coming on to iLearn, so they will be in a digital platform later on in the year. So keep an eye on this space so that you know when all these portfolios are going digital. If you've already completed your portfolios, we will immediately be uploading your records and just making sure that it is signed off as complete for you. Now, all these portfolios need to be completed within 6 to 12 months of you actually joining the trust or you starting your nursing role. So we're going to have a quick look at the community development portfolio as a start off. Now, as you can see, ideally you should get a copy once you start your community nursing role within CLC8. And just briefly to go through it's got an introduction and it talks to you a little bit about all the different aspects that you will be covering. And it looks at the different stages you're likely to be assessed against. So that is on page 6. And for us, we're using the BENA method or competency method of assessment. And basically, we talk about moving from novice, advanced beginner, competent, proficient, and then expert practitioner. Okay, so those are the different categories you can be signed off along. Obviously, for your purposes as a band 5, you may start off as an advanced beginner. And then hopefully, towards a senior band 5, you would probably be an expert or proficient practitioner in that regard in terms of competence. So any of these could apply, and they are interchangeable depending upon the different skills that you're being assessed for. And in terms of the skills that we're looking at, if we look at page 15, briefly takes us through the critical skills that we would be using for the clinical competence. Now, take a note that everything in yellow are the highlighted major clinical skills you need to be completing. Everything in green, or some of the stuff in green, is what we would consider essential or desirable for the different localities and different areas. And these may change depending upon the borough or the locality or the division you belong to. Now, just to highlight some key ones. Ideally, you should be doing assessment and health promotion first because that's the basic fundamentals of nursing from that perspective. Moving on to medicines management, which covers a little bit about the medicines management e-learning modules on iLearn, as well as the IV therapy face-to-face and e-learning on iLearn. Moving on to wound management, which breaks down into 2 components, pressure ulcers and leg ulcer management. And then moving on from there, we've got end-of-life care. Now, some of you might think that end-of-life care might not necessarily be a priority for you if you are a beginner band 5. It might be something that you're looking forward to developing as you get more comfortable and confident within your role. So that might not necessarily be a key priority whilst you're starting out, but it's just something that would be essential for your learning as well as you develop as a practitioner. We've got some diabetes management, and it looks at blood glucose measuring and ketone monitoring, and then thinking holistically about diabetes management. We've got something on nutrition and hydration, promoting continence, which focuses on things like catheter care, bowel and urinary continence. All those subjects would be covered in that category. And then we've got added value skills, things like venipuncture and irrigation. And that covers your diagnostics or your assessments for different things that are likely to come across, or you're likely to come across within the community. Other areas might have a competency on vacuum-assisted closure dressings. Others might have an NG or nasal gastric management dressing, or management of tubes and administration of medicines through NG tubes, etc. Others might have pleural drainage, and some areas might have the anticoagulation or measurement of INR levels. And those tend to be more borough specific or division specific. I would always check with your locality manager just to find out which are the core skills that you need to be completing for your locality. In terms of your team related skills and your professional development related skills, we've got a little bit on communication, teamwork, leadership and management, research and evidence, and then strategy and safety and quality, and lastly professional development and facilitation and learning. And this just looks at, once you've completed your core clinical skills, you can then look at other courses you can attend within CLCH, be it internal or external, that could add value to your learning. Quality projects that you could get involved in for safety and quality in terms of improving the patient experience or improving the staff experience. And then thinking about areas which you could do projects on: research, audit, that can be evidence in terms of actionable care that's producing results. A little bit about leadership and management. We all understand that leadership and management is not specific to senior managers or mid-level managers only. We are all managing our own caseloads, and we are all demonstrating leadership actively in our day-to-day activities. So leadership and management covers pretty much everyone. However, in terms of being responsible for a team, that might be at a more advanced or senior level. And then last but not least, teamwork and communication are essential to everything that we would be doing anyways. If you cannot communicate, you find it a very lonely road in healthcare. Similarly, if you cannot work with others, it might be a challenging road in healthcare. But that's just signposts you to some of the key aspects of practice that you will be assessed alongside continuously as you develop as a community nurse with CLCH. Okay. It is your responsibility to get your books signed off at each point in time. And what I mean by that is your practice development nurse or your team leader should not be chasing you to complete your competency books. In actual fact, it should be the other way around. You should be scheduling time with them to complete your competency books. But maybe to suggest how we would start about going through that. First and foremost, you do have a learning agreement, which you can agree with your team leaders, practice development nurses, as well as your practice assessors within your clinical area. Now, maybe the things that I should also outline is who can assess you. Your team leaders should be able to assess you. If you're a band 5 nurse, ideally a band 6 nurse should be assessing you. If you do get assessed by a senior band 5, then a band 6 should countersign on their behalf to ensure that that competency assessment is complete. Similarly, if you're a band 6, then your competency sign-off will need to be by another band 7 nurse. In terms of completion. However, if a senior 6 assesses you, that will need to be countersigned for by a band 7 nurse. For your band 2s, 3s, and 4s, you could be potentially signed off by anyone at band 5, 6, and 7. It is not the overall responsibility of the PDN to sign anyone off. It is a shared responsibility between the team leader, manager, as well as the practice development nurses. This is just so that in the absence of either one, you still potentially have someone who can assess and sign you off for your skills. Ideally, your initial learning development plan should happen within the first 2 weeks that you start your employment, where you identify what your strengths are and potentially have a discussion about your areas for improvement, so that you can begin to plan the kind of learning that you're going to be exposed to, as well as the caseload that you might wish to manage that would facilitate the sign-off of your competency book. In terms of how you will be assessed, based on the Benner method, we're going to be using the scoring system. And if you go to page 18, you will notice that at novice, you will be scored 1. At advanced beginner, you will be scored 2. At competent, you will be scored 3. And at proficient, you will be scored 4. And lastly, at expert, you will be scored 5. Ideally, what you should start to see within your book is a nice trend that demonstrates that you're improving with each assessment. So maybe in the first instance, you might have a lot of 2s. At the second point of assessment, you might have some 3s and 4s. And maybe at your final assessment, you might have some 5s if a third assessment does take place. Now, it is your choice to sort of say whether you're happy to proceed independently or whether you need additional supervision. From a CLCH perspective, the assumption is that you will complete competency sign-off in 18 months. But maybe let me break it down a little bit for you so that you can understand a little bit about what I mean. Ideally, anyone on a safe, progressive trajectory should complete all their competencies within 12 months. But you might find that somebody might be a little bit slower in terms of their learning, or alternatively may have experienced an episode of sickness that is extended, which complicates their ability to complete those competencies. Or other things you could think about is a bereavement may have taken place, which again took time out of them achieving their competencies. In that period, you would then extend the competency sign-off to the 12 to 18 month period. We're going to have a quick example of a competency that might need to be completed when you're starting out. So take, for instance, the holistic assessment and care planning competency. Now, as you can see, it's got the key aims outlined for that. Now, in terms of preparing for your competency assessment, it would be worthwhile having a quick read about what the main aims for the competency are, looking at all the referenced potential documentation that you need to safely get through that competency. Might I add, the CLCH record keeping competency would be useful to look at. Also thinking about your nice guidance around multi-comorbidity and assessments and management, looking as well at the Royal Marsden Guide, which is the backbone that informs CLCH practice for community care. Thinking about maybe drafting an action plan. Now, either your assessor could complete an action plan, or you could add in details of an action plan, which might put down dates for your first or second assessment, your individual assessment, where you can self-assess. And if you move on with me to the next page. Might give you a good idea of what your competency assessment looks like. Now, I'm going to leave frequency up to your discretion, but I always say, take for instance, for example, with IVs or IV administration. Now, you may see a bunch of IVs within 3 months, and you would make sure that you're complete and completely signed off for the IV competency within 3 months. Or you may see nothing for the next 3 months because there are no IVs allocated to your team at that point in time. All you would be sort of doing is maybe postponing until you actually are able to get official practice and sign off for the competency that you require at that point in time. So if there's nothing available for you to be assessed on, you might not get that done as swiftly as you would like. However, First and foremost, you need to self-assess yourself against the core criteria laid out within the competency. So for instance, you have things like follows NMC and CLCH policy for record keeping standards at all times. Now you can self-assess for that, and you might score yourself a 2 or a 3 if you feel quite confident and confident with that specific component of the assessment. Now your assessor might then come and score you a 2 as they're rating you at the rate of advanced beginner, where maybe you've captured some of the information but not all of the information or majority of the information. Where you've then developed a little bit further on your second visit, you can self-assess again, and then you might sort of feel that you're feeling a little bit more confident because you've had a discussion with your assessor, you've also had a practice, and now you're coming back and you're going through your second assessment, and actually you feel a little bit more comfortable and confident with that, and you might find that you are a 4 or 5 or a 3 or 4 after that session, and that covers that. If there are any comments or concerns that you're not achieving that at any point in time, it is quite key that the assessor makes comments or references in terms of what they think you might need to do extra to help you achieve maybe the competency, so that you are at a 3 and a 4, because that would be your overall target for achieving competence. So that typically covers how your competency might be assessed. If on both those occasions you were still consistently maybe not up to scratch, they may recommend a third supervision and sign off. And that is within the assessor's right to decide whether you need additional input or whether they're happy to sign you off to practice independently because you've demonstrated sufficient competence and proficiency of that skill. Your nurse's reflection is part of the final assessments for each core competence that you will have completed. Now, things to include about that is how you found each skill, how you've been able to adjust your learning to improve your learning as a result of practicing that skill, and what support and how you feel you've been able to get to support completion of that skill, and reflecting on maybe how that skill will improve your practice moving forward in terms of how it benefits maybe the patient, or in terms of how it benefits the team that you're now able to perform that skill. So that could formulate part of process in terms of your reflection. I always say, if you're thinking about it in terms of what went well, what went wrong, what could I do better to improve, and maybe further recommendations for practice, if you think that would be useful to you, then you could also add that information as part of your reflection in terms of final comments. And your assessor would follow sort of a similar plan based on maybe how you have self-reflected in their final comments in terms of their overall achievements. Please note that sometimes we are our strictest critics. So do take compliments when you get them within your books. Sometimes you may have assessed yourself quite harshly. However, your assessor might feel that you're on track and you're doing sufficiently enough. So feel free to accept both positive and constructive feedback. We have a section on page 205, which covers what you would look at for patient feedback. I always say identify a patient that absolutely adores you to get to complete your patient feedback, so that they can give you some good feedback on the things that you've done and how you've supported and helped with delivering quality care to them within the service. Also, it's quite useful to get some feedback as well from your colleagues and the people that you work with if you can, because that just gives you a good sense check of how you're doing and how you're progressing within the team. In terms of the different types of feedback that you are getting, you can always keep a record of all that feedback and use it for your revalidation under your key 5 reflections or under your key 5 feedbacks that you would need for revalidation at the end of 3 years once you've registered with the NMC. That brings us to the end of this session.